Welcome to StartUpHealth TV. I'm Logan Plaster. My guest today is Bryan Mezue, CEO and co-founder of Lifestores, a company that's been with StartUpHealth since 2019. Bryan and his team are from Lagos, Nigeria, a city where hundreds of local pharmacies have become critical components to how people get their everyday healthcare. By upgrading the pharmacy experience and modernizing pharmacy supply chains, Lifestores is meeting people where they're at to bring high-quality care and make it accessible and affordable to more people. In our interview, Bryan and I discussed the opportunities and challenges of building a company in the sprawling city of Lagos, as well as Bryan's creative solution for expanding brick-and-mortar pharmacies in the city. Hope you enjoy. All right, Bryan Mezue, it is great to have you on the show. I want to learn more about Lifestores Healthcare, what you're building there in Lagos, and just your vision for the future. So, Bryan, thanks for joining me.
Yeah, thanks for having me, Logan. So maybe a bit about us. We're in the pharmacy supply chain business, and really, one of our first key insights in this space is that pharmacies play a pretty central role in delivering healthcare, much more important than you might think if you come from a more developed market. People go to pharmacies, firstly to get advice, obviously to get medicines. Often, actually, they're prescribed in the pharmacy. So the pharmacy has these kind of special powers. But at the same time, they have tons of challenges, a very fragmented market. The largest pharmacy chain in Nigeria has less than 2% market share of the pharmacy space. And then once you get below that, there's a lot of informal, what we call chemists, equally, which are even more fragmented. And so, this trend basically brings in lots of issues from fake medicines penetrating the supply chain to really haphazard pricing. There's very little use of technology all across the way. And so for us, we started with the vision of how do we best democratize access to healthcare. And when we looked at the space, it just seemed that pharmacies were the natural first point to start off with. If you can fix the pharmacy supply chain, you really have an opportunity to fix so much more. So we do that. We do that in a variety of ways. We provide to pharmacies to help them with their procurement.
Did you always know that you wanted to come to Lagos to begin a business? I mean, you trained at Harvard. Your partner, your co-founder, is from Stanford. Was that always part of your DNA and your mission, or did that happen while you were studying or at a later date?
Both of us actually had started businesses in Africa before. So my co-founder has started a business in Ghana in the education space. And I did the same in the education space too in Lagos. So we both had tasters of, firstly, what the market is like, what is it like to run a business in these places. But it was a big jump to go into the healthcare space. I come from healthcare from a family background. My co-founder had actually worked in the pharmaceutical space. So we knew a bit, but it was still a massive jump to come in. And we've been learning a lot during the process.
What are some of the unique aspects of running a business in Nigeria? You said you both had that experience. You both are carrying that into healthcare. What did you learn? What was helpful?
I think some of the key things are really how you think about talent, first and foremost. If you've done a startup in a market where you trust the schools to train people that are land on their feet on day one, it's often not the case here. You can get very lucky with fantastic candidates, and we have many of those at Lifestores. But often as a company, you have to get involved in actually training and upskilling people, even if they have great degrees on their resumes. The resilience you need as well in dealing with the infrastructure issues, from energy to kind of transport, logistics, is immense. Lagos traffic is notorious in kind of how long you spend on the day going from A to B. So you just gotta have a lot.
Paint me a picture. Just remind me.
Yeah. So you wake up, let's say 6, 7, trying to get to a meeting on the other side. So we have this dichotomy between the Lagos mainland and the Lagos Island, for example. So you have a meeting on the mainland, or you have a meeting on the island, and you're going from A to B. You could spend 3 hours or 4 hours on the road getting to that meeting on a good day. You can spend the whole day sometimes trying to get from A to B. You've got to learn to be super productive in moving cars and traffic.
Yeah.
And really simple things like that you just get used to over time.
Does the idea of having more localized, like really good pharmacies, does that sort of play into that in Lagos, and the idea that if there's a pharmacy you can walk to, you don't have to travel across the city to a high quality healthcare facility if the sort of individual nodes are higher quality?
That's absolutely right. So for us, it's all about democratizing that access to quality, right? So if your pharmacy down the road is not in the richer part of the neighborhood of Lagos, we want you to be able to get the same quality of service, the same quality of medicines at affordable prices. And so, our core product at Lifestores right now actually is a B2B marketplace that allows any pharmacy to sign up and buy medicines as close to the source as possible. So ideally from the manufacturer, if it's a local manufacturer, but certainly from the first person who imports that medicine into the country where possible. And so that does a few things. Firstly, hopefully that's cheaper because you're buying it higher up in the value chain, rather than going through multiple layers of distributors along the way. But more importantly, you're getting the medicine and it's real, because most of the infiltration of fake medicines, layers of distribution once you get past the manufacturer. So if you can go directly to the source, you're much more able to get real medicines that are affordable to patients. And so we want that to be true for everyone in Lagos.
Got it. So, so you just described a B2B sort of pharmacy platform product. Is that separate from the Lifestores branded pharmacies themselves? Sort of two separate entities you're working on?
So we effectively see the Lifestores pharmacies, and we call them Lifestores Pharmacy as a brand, effectively as a learning stage for this larger play to support more pharmacies. We look at the space and we understand that pharmacies, pharmacists, and their living. We don't want to own every pharmacy in the space. Certainly not. What we'd rather do is support them. And by running pharmacies ourselves, we feel that we've learned lots of lessons about what's broken in the pharmacy value chain. How do you treat customers better? How do you learn and build the right technologies? And we spent quite a bit of time just tweaking our software and our processes based on our experience running stores. And we now feel comfortable to kind of extend that more broadly to any pharmacy across Lagos and across Nigeria.
I've heard that trend time and time again in health innovation. I think it's really smart, this idea of having a brick and mortar opportunity to test out your platform, to test out some of your theses in the real world. It's a barrier to entry. It's a challenge that someone who's just hopping in the market for a quick buck to make an app isn't going to do, and not going to really get it the way you're getting it. So I think that's fascinating. Now that also opens you up to some challenges. You've got to think about, how you locate your pharmacies and space and things like that. And I know you have an interesting concept for that, which would be interesting to talk about, an interesting partnership. I don't know if that's public yet.
Yeah, no, absolutely. I mean, so firstly, you're absolutely right that, we have to be very careful that our pharmacies, the ones that we operate, are supporting the overall network versus detracting from them. And so we're super careful about locating stores when we do have stores. Firstly, in locations that allow us to serve our affiliate pharmacies better. So either because they're a showcase that you can walk into and test our technology live. You can come into them for training. You can come into them for many other reasons. Or they allow us to test out new markets. So if we want to go into a new part of Nigeria, often it's easier to run a pilot farm there first, figure out the logistics of delivering medicines, and then go do a farm, launch the rest of our software there later on. So that's, one kind of very natural strategy of expansion. The second one is, as you say, we have a partnership that we going to announce very soon. It's one of the largest retail supply chains, or retail restaurants, rather, in Nigeria. They have over 100 sites live. And they're an exciting brand that is looking to use that space for more than just kind of FMCG type products and experiences, but also to go into healthcare. And like us, they have noticed that pharmacies play this very central role, and so we've had great discussions. And recently, earlier this year, we signed an MOU to do something together, and we are just about to launch and announce a co-located pharmacy next to their restaurants in the same space. Fantastic, because often you might think, I'm going to get a burger, I'm going to get pizza or whatever. Why would I want to go to a pharmacy at the same time? But interestingly, a lot of the experience, that there are some overlaps there.
Yeah.
Because you have young people who are increasingly interested in how to improve their health, who are often making purchases for family members back home that have health needs. And actually, a pharmacy purchase is often a convenience purchase. So you walk into the pharmacy, maybe you just come in to buy some OTC items, over-the-counter items, and in that moment you realize that actually, I do need, some paracetamol or anti-diabetics or antihypertensive medicines. And so we think that there are, some overlaps in play there. But very excited to announce that we think it's a nice template for us to expand in multiple sites at once in a way that, again, is accretive to our overall network, while supporting our affiliates.
Well, I'm excited for that announcement to come out. I think that idea of a creative collaboration between a healthcare company and a restaurant chain is fascinating and just indicative of kind of where we're at in health innovation in this this era, this need to, this realization of how many pillars in the market actually have a stake in health. And they say, this is important to me. We're just a large manufacturer, but we have a stake in health, and how there are just sort of unknown opportunities there for collaboration. So that's exciting to see. So that sort of suggests that you're going to be really expanding your footprint and not just focusing on the platform, which I think is also exciting.
Yeah, it is. And I think to your earlier point, I think COVID, if nothing else, has shown us that healthcare penetrates and touches upon everything. I think with the pandemic, we are seeing increased interest across the board, and people that that they interacted with healthcare are suddenly starting to notice that. And so I think we think that's an opportunity. And when we think about the two sides of our business, if you will, what's really important to us is that mission of democratizing access to healthcare. And what that does is that it means our first mission is to support the pharmacies. So the platform and the work that platform does, and firstly through our B2B marketplace, to make it really easy for you to get the right medicines cheaply wherever you are. That's our first mission.
Now, break that down for me for a second, because I know access to care is your health moonshot, and it really baked into your mission. I understand how the platform makes the experience easier for the pharmacist to get the drugs correctly. How does it actually open up access to individuals? How would you sort of paint that picture?
Yeah, absolutely. And I think, first and foremost, it's, just to make that point that the platform comes first. And then I think we think about the pharmacies that we operate as supporting that platform. And then I think to your question, when we look at the pharmacy and look at the user experience, people walk into a store, a pharmacy store. Sometimes they come in and they know what they want already. Mm-hmm. Most of the time, there's actually an opportunity there for the pharmacist, if well trained and if they have the right data, to influence that conversation, whether in asking the patient to have a blood pressure check, or a blood sugar test. And we often found in our pharmacies, again, one of the benefits of running our own stores first is that people would walk in, and more than half of the time they had high blood pressure, or they had some condition that they had never noticed before, and we helped them to uncover that, and then we supported them over time to improve their key vitals in that area. So we're trying to offer more pharmacies the opportunity to uncover these things and provide access when the person leaves the store through our technology. And there's a few new features that we're building and are going to launch soon. But everything revolves around taking that experience of a patient walking into a pharmacy, optimizing that experience, and then supporting them beyond the store. Again, using technology in various ways.
You and I were both involved recently in the IFC Tech Emerge conference, particularly around the East African market in healthcare. And there's a lot of talk about leapfrog potential, this idea that without the cumbersome bureaucracy and regulations of some Western markets, that some healthcare markets could leapfrog forward with innovation and kind of learn from the mistakes made by others. And I wonder where you think, when you think about the future and things kind of, if things kind of play out the way you hope, what ways you could see the pharmacies you're building kind of leapfrogging over maybe mistakes that have been made elsewhere in the world.
Yeah, it's an exciting concept, and it's interesting because if you look at many more developed markets, we have this trend of task shifting, which means that we're asking pharmacies and pharmacists to do more and more over time. Things that doctors used to do are now being pushed towards pharmacies, which is interesting because that's where many developing markets like Nigeria are today. So I see that role of pharmacies to take on more and more of the challenge of primary healthcare over time as being quite interesting. Now, obviously, we have to do that in a responsible manner. There are certain things that pharmacists cannot do that doctors can. So we have to know where that line is drawn and where to refer customers over to doctors. But really, for us, it's that exciting potential for a pharmacist to really unlock their superpowers, to catch diseases earlier, to influence patient behaviors earlier, and then really to, when they send the patient over to a doctor, to feed in information in a much more advanced manner. So the doctor knows, okay, tested blood pressure, tested, hypertension, blood sugar, diabetes, and various things along the way. And when they come to me, I can actually dive in with much more measured and targeted solutions. So we see that as, the main leapfrog opportunity is unlocking pharmacy superpowers.
Interesting. That's an interesting perspective that we're kind of meeting in the middle. I think about a CVS or a Walgreens having a minute clinic and starting to staff a nurse practitioner in the pharmacy. And, you're saying this was sort of the function of the Nigerian pharmacy already, where you were going and getting some primary care. So I wonder what that future holds if, as we continue, if the pharmacies will be run by, nurses or primary, family doctors, and it really starts to become an all-in-one sort of node for family health.
I think there's certainly, movement in that direction. And then, technology obviously plays a part as well. You can walk into one of our pharmacies, and our vision is that you can sit in there and, get on a tablet and have a conversation with a doctor if you need to. So telemedicine can happen for folks who are not as comfortable using their phones from home. Head up to your local pharmacy, have a quick check, and then you can speak to the doctor right there from the pharmacy. And so you have, these various kind of vectors of collaboration, as you say, with clinics, but certainly with technology, with potentially even international healthcare providers, using kind of video conferencing tools. So there's definitely this, this confluence of various players in the healthcare space, and we see the first entry point as playing a very important role. And in our case, the first entry point happens to be pharmacies.
Just getting your wisdom on the sort of more global market. When you think about global collaboration, Startup Health represents 340 different companies. Many are in the United States, many are in the West. When you think about collaborating between African markets and the U.S. market in particular, what opportunities do you think are there in are there opportunities to bring technology over, or is the context that you're working in so unique that you have to have your experience? Where do you see that moving in terms of more global collaboration in the African context?
Yeah, absolutely. I think it's a difficult question, and very few people can kind of give you the final answer as to where things will end up. But certainly, there are things to learn from both sides. There's no doubt that in the US there are fantastic innovations that we are trying to bring to play and localize in the African context. Um, you know, Case in point, the growth in telemedicine, over this year has been stupendous, right? And we're trying to see how we can kind of bring some of that innovation to our markets. Um, but I think we have to be careful about taking the template and trying to apply it fully, because there are also many differences. And we have to also look for opportunities where things that we're learning in markets like Nigeria can be repackaged and offered to markets like the US. For example, um, for its faults, Nigeria is a market where people have learned to take care of healthcare payments themselves, not because they're great, but because they had to.
Yeah.
They haven't had too many other options, and
It,
it's a tough.
it's like 95% self-pay, right?
Exactly. So super low penetration rates for insurance. But on the flip side, there's tons of innovations that are now coming through to allow people to save, kind of have group saving wallets, and save cash, put money to the side, for healthcare emergencies. And you look at the states, and especially in areas where people are not covered by health insurance. Perhaps some of those innovations and the way that they've been structured can be ported over as well. Again, it's important to be careful to really understand the drivers of the opportunities and the challenges, and try and kind of tweak things. But at a broad level, there are these opportunities to take a look at very narrow solutions in markets like Nigeria and see where else it can be applied.
Fascinating. Well, Bryan, thank you so much for taking the time to just give me this update on what Lifestores is working on. Best way for people to get in contact with you if they want to collaborate?
So LinkedIn, Bryan Mezue is my name on LinkedIn. And then, you can also follow us on our Twitter channel, Lifestores NG, and Facebook Lifestores NG as well.
Awesome. All right, Bryan. Well, thank you for your time. I wish you the best, and thank you for just dedicating so much of your work life to this Access to Care Health moonshot.
Yeah, thanks, Logan. Great to catch up again, and have a nice one.